I would say like 80 to 90% of our families have that underlying diagnosis of a social anxiety in addition to SM. So we see SM as a result of, we don't see SM causing anything. So
the goal is to conceptualize, to understand that child, that teen, that adult. Sometimes we tell families, look, don't run and get testing right away. Like a 4 or 5 year old, like we're just still trying to figure it out. Even an older child where we're just not sure yet.
Welcome back to another episode of the Unspoken Words podcast, a Selective Mutism podcast by the Smart Center, produced and published by New Edition Productions. This episode features Dr. Elisa Shipon-Blum and Dr. Jenna Blum, the director and lead clinical psychologist of the Smart Center's Counseling and Assessments Department, exploring why Selective Mutism is so much more than just shyness. Dr. E and Dr. Jenna explain the critical differences between shyness and anxiety-based communication challenges, why understanding a child's performance across all settings matters, and when additional evaluation is needed. They also cover the Smart Center's approach to uncovering the whys of selective mutism and how recognizing these factors leads to a more effective treatment planning. If you have any questions on anything you hear in today's episode, make sure to head to selectivemutismcenter.org/askdre and enter your question in the form. And for the best of this episode and every episode of Unspoken Words, make sure you're following us on Instagram and YouTube. We are at Unspoken Words _podcast on Instagram and Unspoken Words Podcast by Dr. E on YouTube. All right, without further ado, please enjoy the latest episode of the Unspoken Words podcast.
before we get started with the episode, are you a parent of a child with SM desperately looking for resources to share with your child's teachers? Last year's Selective Mutism in the School virtual conference sold out, and we're excited to share that this year we're doing it again. Virtually join me, Dr. Elisa Shipon-Blum, and Jennifer Brittingham on April 10th from 9 a.m. to 5 p.m. Eastern Standard Time for practical, evidence-based strategies you can use immediately in your classroom. Whether you are a school psychologist, educator, speech and language pathologist, or counselor, this conference is designed for you. Plus, all attendees earn 6.5 continuing education credits. Learn more and register today. Visit the link in this episode's show notes. Let's help more students find their voice in school. All right, enjoy the episode.
Hello, listeners. Welcome back to another episode of Unspoken Words. And I'm honored today to have Dr. Jenna Blum. Hello, Dr. Jenna.
Hi, how are you?
I'm great. I'm excited as usual, as I am for all my episodes. I don't think anybody's ever heard me say I'm not. But one of the reasons I'm super excited is that I really want to do episodes that focus on more than shyness. And why I say that is the typical dictionary case of a very shy child, help them get comfortable, and voila, speech occurs. As you know, at our center, we don't see often. So I think having a series of more than shyness, where we talk about when is it more than shyness, and what do you need to think about, how do you test these kids, etc. And I think, well, I shouldn't say I think, because when it says I think, it makes me sound like I'm like questioning what I'm saying. I know that SM is so much more than not speaking. All of our listeners know I preach that. I believe that, where SM is a social communication anxiety that has factors into the development and maintenance of SM. And if you don't see SM that way, you're missing the boat in a large percentage of kids. So let's talk about that. How often do we hear kids are just shy and, let's get them to speak? What can we do to get them to speak? So share your experiences with that, because it's really hard for us to hear that when we get emails to the center. I need strategies to get my kid to talk. Are you going to get my kid to talk? What do I tell the teachers to get my kid to talk? And it's that get my kid to talk because the name SM is really lousy. But this is a problem. Like, talk to me about this, because you see so many patients with SM. You do so much testing. Tell me what you're thinking.
Yeah, I mean, I definitely think that there are a percentage of kids that have timid temperaments. I would say like 80 to 90% of our families have that underlying diagnosis of a social anxiety in addition to SM. So for those families, there is, quote unquote, some shyness that's occurring, where building up some of those comfort skills allows them to move more into communication, whether that's verbal communication, using a parent as a verbal intermediary, or even nonverbal, doing more hand over takeover engagements. But like Dr. E is saying, I definitely think there's a large chunk of our families that we work with, if not all of them, where, yeah, there could be some shyness that's occurring, but there's so much more beyond that surface. And I think that's where we differentiate a lot of that, within our treatment, is uncovering really those whys of SM. I know we've talked about this in other podcasts as well, but we really do dive deep into those underlying whys. We see SM as a result of, we don't see SM causing anything. So it's not just get comfortable, get our child to speak, but rather what is making them shut down in those moments, and how can we move forward from that. So we actually uncover those underlying whys, and that's actually exactly what we work with and what we quote unquote treat, right? We don't treat to speak, we treat the person. And so when we figure out those underlying whys, it makes it that much better and more, it makes the treatment plan more comprehensive and allows us to feel more confident in that approach.
No, really well said. And I think one of the problems with it's just shyness is that it frustrates parents, it frustrates teachers, and most importantly, it really frustrates and often causes shame, avoidance, more anxiety, depression as kids get older, because they're very misunderstood. And when that approach is, let's get them to talk without understanding, which is why for us, that selective mutism eval, and I'm sure a lot of other clinicians have similar types of evals, where the goal is to conceptualize, to understand that child, that teen, that adult. What is it about them? Like, who are they? What are the stages in each setting? What are their underlying whys that are causing this child to have difficulty speaking? Like, you could have a child respond one or two words. They're not elaborative. They're not initiative. You could have kids that are constantly taking a delay in their response. These are kids that sometimes, you have challenges with academics. They don't have challenges at home, or they do. It's about understanding them and what do we need to think about. And this series is going to go into that. It's going to break down the different segments of more than shyness, when there's additional challenges. But today I want to talk about when additional testing may be needed to kind of dive deeper than the selective mutism eval. And I do want to mention that a really big part of working with kids with SM is, how are these kids performing at school? The selective mutism assessments out there often focus on where they're speaking, where they're not speaking, who they're speaking to. But to me, that's like stage 3. What are their stages in other settings? That's why we use the social communication anxiety inventory that breaks it down into the bridge and the different stages. But a big part of our evaluation is, what are these kids like at school? Are they starting, completing work on time? Are they below, at, above grade level? Do they have difficulty? Do they hesitate? Are they a behavioral challenge in school? What is their social communication like with peers one-on-one, with teachers one-on-one, in groups, large and small? Really deciphering, what are these kids like in school? And then what are these kids like at home? Because some of these children who have issues at home and school have other underlying challenges that so many people think they're separate than SM. But what they don't realize are those are the factors. So talk to us. I mean, just this week alone, I know we've talked about cases you've had of cases of kids that they've missed the diagnosis. They've missed the more than shyness and frustration that exists with teachers during school consults. This kid's being defiant. This kid's being difficult. Like, why aren't they talking? I saw them talking to their family at home, or in the parking lot, rather, like in school when those demands are higher. Talk to me about that. Talk to me about some of the clients you're seeing.
Yeah, well, I think that you bring up a really good point about assessing further in schools, because I think many times teachers are feeling that the selective mutism is causing a lot of these other challenges. And so when, treating to quote unquote speak is that mentality, they're not really focusing on those underlying aspects of, like, well, why are they hesitating with their work? Why is it that they're constantly looking at their friends' papers before they initially start their task? Why is it that they're, having trouble attending to various aspects in the room? Why is it that they're getting distracted, right? So there's a lot of components that are going on. And I do think that, like Dr. E said, we need to assess what's going on in the home environment as well, because there are many individuals that, as we know with selective mutism, based on the setting or based on the person that they're with, they could change their level of communication, right? Their stage of communication. But there are many different individuals that from a behavioral standpoint, you're still seeing some of those commonalities in different environments and with all different people. So if that's the case, like if you're noticing, for example, like if we keep to that trend of the attending or having trouble initiating tasks, having trouble planning and organizing their thoughts, if you're seeing that at home, let's say you're a parent who's noticing, oh, when I do homework with my 7-year-old child, and every time we sit down, they're still having this trouble, right? And there's no social communication challenge at that point because they're completely comfortable in home. There's probably something else going on in terms of what that underlying why is. And it could be, again, maybe there's a relative over or a friend over that's causing some of that trouble. But if you're just in your natural habitat and your child has no anxiety present and you're still seeing those underlying challenges, that is when we would further recommend that further testing, which whether that's ADHD testing, if there's underlying processing or learning challenges, doing more of our, what we call our fuller batteries, where we do like psychoeducational testing and figuring out more of their academic and cognitive baseline. There's so much more that we could expand on. We do a lot of autism testing if we're seeing a lot of those social challenges in all aspects, not just from a aspect of trouble, with social communication, but if you're noticing even in the home environment, having more difficulty with reciprocity, your child not always coming up and asking you a question, or your child having more of these restricted interests, at home, and you trying to shift a task and they're just so preoccupied, if there's aspects to their social communication that you notice those nuanced oddities even in the home environment, right? That's when we would recommend that further testing. So it's not just when they're in their uncomfortable environment, let's do that testing, but rather when we're trying to figure things out and there's still that kind of diagnostic question mark even in the home environment, it's so beneficial to do that.
No, these are good points. And as we know, when we talk about selective mutism, 30 to 40% of kids have underlying speech and language issues, but they're going to have those issues at home. It may be not as common at home or less obvious because the language is so kind of typical. Whereas in school, when the language is more deconceptualized, it's more trying to put thoughts together and say it and answer questions they're not thinking about. It's much more difficult and it becomes much more obvious, especially if they have other anxieties. So I think that's important too, because we need to know what's happening in the home and school to be able to say, is this anxiety causing some of these difficulties? Because anxiety can cause receptive and expressive language difficulties in terms of like not a true difficulty, but almost appearing that way. It can cause a child to look inattentive. It could cause a child to be avoidant and not start and complete work on time. It could cause a child to have behavioral difficulties, like it's more of a generalized anxiety or other anxieties. So it's really important to understand that. I think that what I would like to talk about is when it is more than just shyness, when do you kind of think about that? And I think for me, what I think about is the child is pretty stuck. The typical get the kid comfortable, ask them some choice questions, use some visuals, pair them with buddies, have some play dates. It's just not moving quickly. The child is more stagnant. Of course, if you've got that treat to speak and the child is in the nonverbal or non-communicative and they're not ready to speak, it could certainly, exacerbate these difficulties and anxiety because that treat to speak philosophy does not work for me unless they're verbal and you can really talk about talking when the child's ready to talk about talking. Right. So the bridge for us, to me, is all the stages. Children feel relieved when they realize, wow, I am on the bridge. I can do this, rather than all that I can't do, and which is why the social communication anxiety inventory, and we welcome clinicians. It's on our resource page to utilize the bridge, because I can say with, full certainty that kids are not just mute and that there are stages of social communication, and respecting that gives the children a sense of control. It also is a huge relief. And we see that at camp. We see that with parents at camp. It's really important. And I think we need to see that if a child communicates freely at home, but not in school or with adults, we need to think about, okay, why is this child fine at home, but out and about, they're really having challenges? High levels of distress, shutdown, or avoidance rather than mild hesitation. Communication effort appears exhausting and overwhelming to a child. Figuring out the social puzzle, just really avoidant, really shut down, really not interested. And then, of course, with increased difficulties with academic and social demands as they grow, some of these difficulties when the child is 4 or 5 may not be seen as much, but they become more obvious, as I call it, air their head as children get older.
Right.
So I want to kind of share anything you want to say to that, because I just talked a lot. I'm good at that. I talk a lot because I have so much I want to say in a short period of time, Dr. Jenna.
No, I don't think so. I think we can kind of keep moving forward.
Yeah, and I want to kind of put out these kind of astonishing statistics. Ready? 80-90% have social anxiety. But 20 to 30, many kids have coexisting conditions. Many, 20, 30, 40, 50%. You see this in our population. 20 to 30% have generalized anxiety. 10 to 30% have specific phobias. 15 to 35% have specific separation anxiety, in addition to social anxiety. Kids with SM that have speech and language, 20 to 50% expressive receptive, pragmatic, auditory processing difficulties. 10 to 35% have executive function difficulties. Can you kind of explain executive function challenges and a little bit about auditory processing? Because I don't want to jump ahead, and language processing, because this can be up to 35%, Jen.
Yeah. So executive function challenge a lot of times falls under the umbrella of attention deficit hyperactivity disorder, ADHD. So basically, when you think of executive functioning, right, that's kind of the umbrella of planning and organizing and switching tasks and, your working memory, your ability to sustain your attention, right? There's a lot of aspects to executive functioning. Actually, emotion dysregulation is a component as well. And so that's very fascinating. A lot of people don't always, look at that aspect. And so there are centers where, we'll get a child coming in and they have an oppositional defiant disorder. But then later on, we do further testing and we find out, no, they actually have ADHD. And that's more of the impulsivity and hyperactivity coming out. So executive dysfunction is definitely a big common aspect. And what's interesting is, I don't necessarily have research on this, but what I have found, and I'm curious what your thoughts are, is there's many individuals that we work with where as they're overcoming more of their mutism, some of their other comorbidities are almost coming out more.
Yeah.
So
Great point.
yeah, so it's almost like their mutism kind of puts them in this shell, right, where they're kind of more stuck. And so it almost makes some of their other comorbidities hidden, right? They're so frozen that some of their other aspects are kind of hidden within themselves. So as they kind of come out more and become more of like that butterfly, like we always talk about, a lot of their other aspects are kind of fluttering around and coming out. And so I find that ADHD is one of the most common that I've noticed, where individuals will overcome their SM. They've graduated now from our SCAT program, but yet now they're seeing more of that inattentiveness come out in the school setting, or they're seeing more of that hyperactivity, the impulsivity. And so that's definitely something that we find often and we'd want to dive deeper into. So that's where also it's important to note, as you're working through treatment and maybe you're not sure of some of these things, talk to your provider, talk to us about what you're seeing in the home environment, because sometimes actually oppositely, you're seeing some of these additional challenges at home, but because they're so frozen in school, the teachers are like, no, none of this is happening. And it might not be that they don't have an underlying challenge. It's just that their mutism or, their presentation at that time is making them so shut down. So that's also something to kind of keep in mind. You also mentioned auditory processing. And I think something to keep in mind in that aspect too is that is a huge component, is kind of having some of those underlying like processing challenges. And so if your processing speed is slower, right, and someone's kind of like shooting you all these different questions, think about how overwhelming that could be when you're still just kind of thinking about what you might want to say, right? Is that like the tip of your tongue? So that's where like all those underlying strategies of like choices and visuals and things like that are always really helpful. But even in the home environment, keeping that in mind, like those types of strategies are really useful, because a lot of our children and teens that we work with do have that underlying challenge. And so we don't want to ignore that because that's part of their puzzle, but rather we'd want to be aware of that and how we can kind of navigate both of those things.
I had a boy I was working with, and he had SM and, diagnosed, and everyone was focusing on it. And turns out when I would work with him in session, I would say stuff and he'd kind of look at me with a kind of a little bit of a blank look. And I noticed that as I gave him time to respond, he'd almost give me an answer after like the typical give and take. And he didn't look anxious. I need to say that because I think it's important to understand that kind of look, listen, and learn from these kids. They tell us a lot by just how they respond in general and how they look, their body language. This kid was not anxious. It turns out he had auditory processing difficulty. And when we gave him accommodations for that, he needed headphones in loud, large, lots of people environments. He needed to do certain tests in other rooms. He got distracted easy. He couldn't follow a series of directions. So the parent would get frustrated when she'd say, hey, Trevor, go upstairs and get your socks, your jacket, and your book. He'd come down and be like nothing in his hand or one thing. And she'd be like, come on, I told you, we're in a rush. We're in a rush. We're in a rush. He was so frustrated. So it caused a lot of behavioral problems. That's just one of millions of examples I can share. But I want to give a tidbit to our audience. The less socially anxious they are, the less they appear anxious, right? The more they seem comfortable, but yet they're still selectively mute. They're still mute in settings. They're not making that progress you think they should. The more these other disorders are prevalent. 100% correlation with the less anxious, the more comfortable a child feels, unless they're a speech phobic where they've had the high expectation of speech and they're stuck in the nonverbal, the professional mime kind of guy or girl. The more that we think about the others, the whys. And I think that's such an important quote, that the less anxious they appear, but they're selectively mute, the more you need to think about other disorders. Now, as children age and they become older kids and teens and adults, they may not seem that anxious. So they may get used to it, right? And so they're more avoidant. So it's all about figuring it out. But that correlation is, really important. And we talked about the ADHD, the executive function, but autism, 70 to 30% of kids can have comorbidities. We see so many kids at our center. Is it SM or autism? Is it both? And we see those misdiagnoses, the missing it. I mean, I'm working right now with a 15-year-old girl who literally, she can speak. They can speak. She's not as initiative. She's not elaborate. She's not interested in friends. She's not interested in practicing her goals, lacks internal motivation. When she's around other kids, she doesn't look anxious. She seems disinterested. There's a lack of motivation for friendships, for connection. Is that because of the years of failure, or is it because she really can't figure out the social puzzle? She has an oddity to her voice, like it's kind of a monotone talk, and she talks like that at home. And when we really, when you get a picture from the teacher, she just seems disinterested in social. We try to buddy her up. We try to give her areas of high interest, but she's focused on the interests, not the friendships. Anyway, she has autism and SM. So we were very adamant about do this testing. The parent was like, I don't think it is. And I'm like, look, unless we do this testing, I really can't tell you with certainty. She had level 1 autism. And I can't tell you again how many kids and then are misdiagnosed or mismanaged and they're funneled wrong. Or the kids diagnosed with autism and they don't have autism.
Right.
How many kids do we see at camp that come to us with a previous diagnosis or at our center and they don't have it? They have SM from an extreme social anxiety and avoidance. And many of these kids, like you said, they have an ADHD diagnosis. Right. There are comorbidities with ADHD and anxiety and ADHD and autism and yada, yada, yada. So it's really about figuring out that person. Yep. Sensory issues, Dr. Jenna. Gosh, 40 to 80% of kids, auditory, visual processing, tactile, loud, large, lots of people environments, brushing the hair, the food, the picky eaters. You got to know this when you're developing a treatment plan. Mm-hmm. Thoughts? Share, please.
No, I think going back to what you were sharing in terms of the autism piece, because this is probably one of the most common diagnoses that we see a lot of these question marks for in terms of previous centers. I think a lot of the research out there, unfortunately, there are some people that don't believe that selective mutism and autism can occur at the same time. And so we do want to normalize that it definitely can. And we want to get that really out there because I think unfortunately there's families that are struggling in both realms, and we want to normalize that component of it and share, the aspects of how that can occur. I think in terms of the misdiagnoses, like you said, there's many families that come in and they unfortunately get a inconclusive report out. So basically, when a child is mute, a lot of times there are troubles with assessing them because there's verbal tasks that they're unable to assess. And so many times, unfortunately, tests can come back inconclusive. We see this often. And so we do assess nonverbal kids. Obviously, that's what we specialize in. So there are times where families will come and they'll provide us with their previous assessments that show inconclusivity, and we'll be able to, further assess them. Oppositely, like Dr. E said, there's times where, there are individuals that, maybe do have a previous diagnosis, or there's further testing where we're unsure if that's really the diagnosis that makes the most sense for them. And so we have done some reevaluations just to further explore that as well. So there's definitely like a lot of different aspects of ways that we can support, but I think that that's really important. And I want, you as listeners to know that, because I think that a lot of families feel very lost and feel very uncertain about what next steps they want to take or can take. And sometimes schools will share with them, like, listen, like this child's in the lowest reading support, and a mom's frustrated because she's like, well, I don't understand. My daughter's reading to her younger brother at home. Like, I know that she has this ability. So meanwhile, the daughter at school is now in the lowest reading level, and she's bored because she's a really good reader. So we would want to explore and like provide more of that baseline of like a cognitive academic level. And then oppositely, we have kids that maybe do have an underlying reading or like dyslexia challenge, and they're not able to be assessed for that. And so we can kind of explore that. So if they're sitting in a space where, their teachers are having trouble and they're thinking it's just because they're shut down and they're timid, but rather they have that underlying challenge, we'd want to confirm that diagnosis. So it kind of works, like we're saying, it works both ends. And so I think it's definitely something that we want to ensure to families that we can talk through and we can work through, because like I said, I think there's a lot of families out there that don't always know like what that next step looks like. So we'll get back to the episode in a second. You're exhausted from advocating, explaining, and hoping someone finally understands. Well, we do. This summer, consider Communicamp for you and your family. Communicamp is the Smart Center's intensive all-day treatment program designed to help children and teens ages 3 and up build social communication confidence. Over the course of one full weekend, your child or teen receives 15 plus hours of expert-led skill building, while parents receive 15 plus hours of training and support. Our clinicians use Dr. E's evidence-based treatment, SCAT, that's helped thousands of individuals find their voice. Here's what matters. Unlike other programs, your child or teen doesn't need to talk to come to camp. We meet them exactly where they are. We have 3 Communicamp weekends happening this summer: June 26th to 29th, July 16th to 19th, and August 7th to 10th. Visit the link in this episode's show notes to learn more. Stop waiting for your child or teen to grow out of it. Make it happen this summer. All right, let's get back to this episode.
Often when I do school consults, and I'm sure you experience it, which is in relation to what you're saying, they can't assess these kids because they're so focused on getting these kids to talk, which causes more anxiety for some of these kids because they're just not there yet, that underlying issue gets squashed, but that they often see it separate. So we notice it's taking him longer to complete a task or to get started. It's taking longer. He's looking at his friend's paper a lot. They don't see that. They sometimes don't see that connection between that's a why, maybe. Mm-hmm. So then you try, the child had some testing or they didn't have testing, but then they don't know how to test. So that's inconclusive. And then like, we see this a lot with speech and language where they can't test these mute children. So what do? Well, one, you find a center that specializes in testing selectively mute children to be able to differentiate, to use appropriate accommodations. I know we were the leading center under Dr. Evelyn Klein and Dr. Sharon Armstrong that did the original testing of children with selective mutism in speech and language. And we have that. We can certainly add that to the show notes. But we were that original center. So having parents as evaluators where they're being taped is a way to get more accurate testing of kids' speech and language. And again, 30 to 40 some percent have underlying speech and language, whether there's a developmental piece when they're during the language formative years, you notice that they have a difficult time keeping up with conversation. The conversation comes and goes. They're not as expressive. They're not as narrative. They're not able to explain as well. It becomes frustrating. They become mute. The conversation comes and goes and they're like lost in it. Or as they get older and they haven't had the practice of give and take back forth of social communication, they develop an acquired speech and language issue. And so that's speech and language, right? But then you have the whole psychoeducational aspect of all of this as well, that you really need. Now, not all kids need it. We're talking about this podcast to say, when is it more than shyness? When is it more than being timid? And if your child is not making that progress, is it too focused on speech and they're not there yet? Or is it that you're missing a diagnosis that's causing them not to be able to do it? I will tell you, I'm thinking about a 9-year-old little girl that was in elementary school. She was talking to her friends. She was able to answer her teachers, but she really was an expressive narrative. She would become more shut down during academics. She would look at her friend's paper, but she would talk to her friends on the playground. So she was diagnosed with SM because in larger groups and smaller groups, she didn't communicate. During academics, she was pretty shut down. So she met the diagnostic criteria. And even in the real world, during like restaurants and situations that required her to kind of put her thoughts together, like it was basically the school did not see any learning issues. They thought it was a behavioral difficulty. And when I saw her in session, I noticed she couldn't write well. She was avoidant. She was very dependent on her sibling in session. She really, really struggled. And I'm like, something else is going on, guys. Like there's something being missed. Anyway, we got testing and she had dyslexia. She had dyslexia and a mild form of ADHD. And it was interesting because once we put those accommodations in with the dyslexia, she made tremendous progress. Her self-esteem improved. So she could talk. The academics were such a piece of this. And so this podcast is directed to more than shyness. And I think it's really important because 20 to 40% of kids have some additional learning challenges. That's a high percentage, Dr. Jenna.
Yeah. Well, and I also want to highlight that so many of these kids and teens that we work with, especially when, like you're mentioning, there's this high expectation for speech, so many times they're hearing, well, come on, just say one word. Why aren't you talking? Why aren't you talking? Why aren't you talking? And they might not even understand some of their underlying challenges. So they might be thinking like, I want to, right? And obviously, again, there could be components of why they're feeling stuck in that moment. There could be higher expectations, but some of it, like you're saying, could be that they might need a few step-by-step, ways to help them navigate, or they might need, okay, first we're going to do this, then we're going to do that. Or, there's so many different components of ways that we can support these individuals. And so like you're mentioning, the amount of confidence that comes from hearing that there might be this underlying diagnosis is so impactful, not just for families, but also for the individual when they understand like, wow, like this makes sense why maybe I'm having more of this trouble. So I definitely think we want to work with you on figuring out like when is it more than mutism and how can we take it kind of one step at a time in that moment.
Yeah. And I think certain strategies and interventions, many strategies and interventions can work with many, right? The visuals, the choice questions. Yeah, we know that, right? But certain strategies like the write and read and preparing and asking again and avoiding, like certain strategies, giving more time to complete a task, focusing on other kids first, may be more exaggerated for one particular child than another. So certain strategies and conditions relate and what is more needed. So for example, even at home, like you were sharing, we have kids with open-ended thought-provoking questions without being prepared, shuts them down. They get frustrated, behavioral problems. They start to get mad, upset. Parents are frustrated. There's family challenges. Everyone's getting mad at each other and blah, 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 blah. And it's like this whole hurricane occurs when in reality, this poor kid has an auditory processing difficulty. And so the more that we prepare, the more we're slower in how we respond, the more we may have labels for some kids with speech and language issues, the more we ask them a choice question versus an open and thought-provoking question without preparing. Going to visit Aunt Sally and Uncle Bill and knowing what questions could they ask, getting prepared, creating the interviews, the games. There's a reason, listeners, There is a reason why these games and goals work. And there's a reason why these games and goals are individualized for each particular child. It's not just getting them to talk. It's giving them accommodations, interventions that are specific to their needs. So when we're at Communicamp and we've done the selective mutism eval and we know that kid's needs, what one counselor is working on with one child is different than what they're necessarily working on with another child, especially when we do these pullouts. We're helping them do this by giving them the specific strategies that work for them. It's not just let's get them to talk and be courageous to talk. Of course, it's courageous to do things, but it's courageous to hand money to a store clerk. It's courageous to be able to go up to a friend and say hello if they're verbal, or I am and I just statements. How are you? Good. How are you? I'm great. I just started soccer this week. Like, we have to teach some of these kids to do this. We need to give them written assignments to do with aunts and uncles to be able to help them using a script approach. I mean, there's so many things we do. I always say that every child, every teen, every adult we work with, there's a unique recipe that is their recipe. So yeah, you can make chicken soup, a million varieties of chicken soup, but it may taste different. It'll be different with the ingredients, more or less, for different chicken soups. Do you think that's funny that I'm comparing a selective mutism to chicken soups?
Yeah, a little bit.
But I hope it gives our listeners a conceptualization that everyone is different and what works for one child may not work for another.
Yeah, I usually mention like ingredients for like baking a cake. And so I guess it's kind of similar. Like I'm like, when we want to bake a cake, like every type of cake has different types of ingredients. So if we're just like, oh, let's bake a cake and you're looking at the outcome, you might not always understand like what specific things kind of go into that piece of it. So I guess it's similar to your soup.
Soup. Yeah, I think that I'm going to start talking about the cake because that's more delicious to me than chicken soup.
Yeah, it's it's great. I think families enjoy it.
And I'm really good at making a chocolate banana cake.
Yeah.
That's
that's
right?
Probably one of the only things you can make, but it's great.
Oh, thanks. You didn't have to emphasize that.
It's great. I mean, it makes it worth it, honestly. You don't know how to make many things, but that's a great one. But anyway, let's get back.
Yeah, let's go. I'm also not a good parallel parker, let's be honest. I try, but it's tough. But anyway, everyone
our strengths.
We know our strengths, which leads me to big shot roles. Okay. Mm-hmm. Like, these kids, we're talking about more than shyness. We're talking about these comorbidities, these co-occurring difficulties, and how we have to shape strategies, interventions, accommodations, etc., interventions, 504 plans, IEPs, teaching parents, teaching teachers. Like, it's so important. And I just feel that actually I got a little lost in thought here.
You were mentioning big shot roles.
Oh, yeah. Big shot roles. There's so much to talk about. We emphasize what they're not doing and what's challenging, but all of the kids, all of the teens, everyone has strengths in some area. And it may not be the same strengths that other siblings have. It might be different. It might be different than what the parents have interest in. I always give examples of my juggler. I remember my juggler who loved to juggle. And that was his big shot role. And we use that in clubs. We use that in getting together with peers. He joined the circus club. He joined the circus outside. He ended up going to an Ivy League school, did amazing, but that was something he really loved. The baker, the chess player, the runner, the jogger, the person that can sew, the person that can build, the person that's amazing at puzzles. Like, what are your child's strengths? And as we're accommodating and providing the interventions for their challenges, let's build up those strengths because that's where their anxiety is the lowest. And having a big shot role is confidence boosting. It's self-esteem boosting. So we cannot forget the big shot roles, the confidence boosting.
Exactly.
Yeah. I think that's super, super important. So different, many families are listening to us across the world, across the country. If you're suspecting there's any challenges with your child, in addition to more than just shyness and the typical treatment approach is not working, the child seems struggling more in school than seems typical, it's more than anxiety, this is where you need to talk to your treatment provider. And could there be something else? Mm-hmm. And, thinking about additional testing if that's needed to be able to be more, to pinpoint more, for those particular children.
Yeah. I also think like that's where you can lean on us to be that provider to help guide you. We do have a selective mutism evaluation for families that, we can work with from a treatment perspective in other states that we can work with. And then oppositely, we have something called a selective mutism interview for international families or states that we can't necessarily do treatment in. But they're both very similar in the fact that we do explore a lot of these underlying whys of selective mutism. So even your first interaction with us, whether you're in active treatment or not, we will be discussing a lot of these things, and we'll be kind of getting into this like underneath aspect, which is probably one of the first times that you'd be going over something like this when you have maybe even done other types of selective mutism treatment. I get that feedback a lot when I do my SMEs and SMIs, is that families are like, wow, like it's so interesting that you're asking me about speech and language challenges, or it's so interesting that you're asking if my child is learning processing challenges, like usually they're just asking me questions about where they're talking or where they're not. So, we explore a lot of these things. So even in sometimes the initial evaluation that you do with us or the interview, we will be talking to you about what we maybe recommend further. So sometimes it's, hey, let's continue to observe you and maybe start with more of an individualized or group treatment with us, or we can kind of have more of that time to assess what's going on. And other times it might be, hey, you're sharing that you have some of these concerns, you're talking about it, you recognize that maybe you've gotten an invalid assessment at another time of your life. Maybe your child's going into middle school and you really want to make sure that you're getting the best type of accommodations for them. We can talk through that. And maybe in that initial evaluation, that's where we'll talk about those next steps. So
And
definitely something that we can explore together.
And so with that said, I think it's important to know that if you have an amazing treatment provider that you absolutely love, but they need more guidance, maybe they're not specialists in the field, that you feel, they're like very open and saying, hey, listen, I really want to learn. I really want to, we do professional consults all the time. And I have to say that the selective mutism eval is a way for you to take that evaluation and share it with your school, share it with your provider, share it. It's a very comprehensive eval. It's based on my original selective mutism comprehensive diagnostic questionnaire, my SMCDQ, that was a 24-page document to really understand and conceptualize the whole person. And I would say for families that whomever you're working with, it is more than not speaking. If your child is like, it's more than not speaking, you see these other challenges that we're giving you throughout the podcast, please explore this with your provider. By all means, stay with that provider, talk with that provider, share these resources. Like, our mission in life is to share these resources, educate others. I mean, we just did a huge fundraiser in Florida called through the Selective Mutism Research Institute, which helps to do research, which helps to get these percentages, which helps to explain what really is SM. What is it? What are the characteristics? What are the comorbidities? What are the treatment strategies that work best with different kids? And I think that's really, really important. And I think for parents, this is a relief often to hear, wow, there could be something else. Is it more than shyness? And knowing that there's people out there that can really help and support you is important. And you said something really, really good that you said a lot of good stuff, but mention, like, we notice at Communicamp that sometimes we tell families, look, don't run and get testing right away. Like a 4 or 5-year-old, like we're just still trying to figure it out. Even an older child where we're just not sure yet. They're showing signs, but that doesn't mean you dive into treat, these assessments right away at all. It means let's take a monitor. Let's wait and see.
Right.
And we will see sometimes at Communicamp or individual care signs of some of these other things that maybe you didn't even mention. Like, we saw signs, we thought about it, and we're like, wow, yeah, this is there. We see it. We see this. These are things you may want to continue to monitor, but maybe get testing. Talk to your school about it. We have a lot of schools that will come to us for independent educational evaluations, IEEs, because they have difficulty assessing a mute child. But if you're in other states and you can't, fly to certain centers, I would say talk to your school about it. Talk to your treatment provider about it. I think it's really important to bring these flags up of the different comorbidities that we talked about. Parents, I hope you're getting a lot of great information. I hope that this is eye-opening. I hope there's aha moments coming to you. I hope for teachers that are listening, you're seeing these different things to think about in your kids that you're educating. And I'm excited to do more than shyness episodes. Throughout our podcast series, there are a lot of episodes that are about the Ys and 504s, IEPs, and different comorbidities. But we're really going to dive in more to the specific types of learning difficulties, different types of strategies that work for different learning difficulties. How do you test those kids? What do you look for in testing? So I am excited, Dr. Jenna, to dive in a little more deep into some of these things. And if you as listeners have specific questions, please write to us. You can write at support@selectivemutismcenter.org. In the show notes, there's other ways to contact us. We take all of your questions. We answer them in podcasts and blogs. You know, it's really important because we want you to feel supported.
Yeah, that's what I was going to say. I was going to say, if you have any questions, we're starting to do more segments with Ask Dr. E, where I'm coming in as well. So it's an Ask Dr. E, Ask Dr. Jenna series. So if there's any additional questions specifically around some of the assessments or more than mutism, please write your questions, and we'll definitely have a podcast where we'll talk more about it.
Thank you, listeners.
Thank you.
Look forward to your questions. Have a great day. Thank you for listening to Unspoken Words, a Selective Mutism podcast hosted by me, Dr. E, and the Smart Center. This episode and all episodes of Unspoken Words is produced by New Edition Productions. Don't forget to submit any questions you have from today's episode using our Ask Dr. E form on our website. Just head to selectivemutismcenter.org/ask DRE. I'd love to answer your question in a future episode or blog post. Remember, for the best of this episode and every episode of Unspoken Words, please follow the podcast on Instagram and YouTube. We are at Unspoken Words _podcast on Instagram and Unspoken Words by DRE on YouTube. Or join our newsletter for additional SM content. We release new episodes every other Monday at 6 a.m. Eastern Standard Time. We'll see you next time.